The biggest difference between the many doctors and professionals that I've seen in the past versus the clinicians here have been, one, understanding of me. People always have opinions about how to live healthier, but the person I saw was very helpful in terms of specific foods you could eat, how much to eat, how to add that to your current diet. So I kind of explained how I eat now, and she kind of, I guess, embedded a program that would be something I would actually use instead of saying you have to scratch what you're doing and go on this completely new diet. So my experience working with a dietitian and cardiologist have actually been really positive. One, I believe they were in sync in terms of being on the same page, and that really helped me kind of blend in my diet and health with understanding of why my cholesterol level is high and how to take actions towards improving it. The biggest successes for me is really feeling good. I feel good about myself. I feel like I have more energy for my family. I seem to be happier, and that means that people around me are going to be happier. And I can take care of my family better, including myself.
I was the spitting image of my mother, both very heavy. I just look a lot like her. My mother died when she was 62. Her mother died at 57, mostly from issues related to being overweight and all the things that go with it. I wanted a future longer than 10 years. That sounds shocking, but it was. So I wanted to change that equation. I knew I was overweight and hadn't really had much success dealing with it before. The thing that made the changes more permanent for me was that I did the process slowly as recommended. So it was a gradual progression into a new eating pattern, and even the walking, which is the exercise I did almost exclusively, was pure walking, became something now I wanted to do. It just is part of my life. And to a very large extent for me, it was if you do what the program asks you to do, it gave me the result it said it would. It's made such a difference in my life. I just feel so much more able to take on anything I want.
I was having a progressive weight gain that I didn't feel I really was in control of, and I didn't feel like I had that much of a motivation to do anything about, but I knew it was something bad and that I had to do something about it. I feel like I've been very successful in the program because I've kept my weight under control after an initial 10 to 15 pound weight loss here. And whenever I drift in the wrong direction, drift upwards, or stop exercising as much as I should, I remember what the folks here told me, and I go back to the basic 5 or 10 things that they recommended as far as modifying my lifestyle, and it works. It works as well now as it did 5 years ago when I first came here. I see patients with all sorts of cardiovascular issues, from high blood pressure to cholesterol management, to patients who've had heart attacks, to patients who are in severe heart failure, sometimes needing heart transplantation. They look for ways that merge and blend with the patient's lifestyle and their abilities in order to achieve a sustained weight loss. I find patients I send here come back with their weight going down and with an improvement in their daily exercise capacity, because they really look at the patient's motivations and try to figure out what will make a patient change their eating habits, change their exercise output in a way that they could sustain over the long term.